Have you ever been told your second molar is unrestorable? Maybe it's badly decayed, maybe it's had a root canal and crown that's now failing. The big question patients often ask is, should I replace that tooth? Most of the time, the answer is simple. You may be just fine without that second molar. A lot of patients never even notice the difference once the second molar is gone. That said, if you really miss having that tooth or you feel like the gap's affecting your chewing, replacement is possible. But you need to understand what you're getting into. If that second molar has to go and you want to keep replacement as an option, we usually do what's called socket preservation, which is the bone graft we do when we pull the tooth. This just helps prevent your bone from shrinking too much after the extraction. After about 4 to 6 months of healing, we can take another look and see if an implant makes sense. But here's where things get tricky. For upper second molars, the biggest problem is your sinus. Over time, the sinus cavity expands into the space where your tooth roots used to be. So there's often not enough bone height for an implant. To replace a tooth, most patients need what's called a sinus lift. At North Texas Dental Surgery, we wait 6 months after sinus lift before moving to the next step. Then, once the implant goes in, we usually wait for another 6 months before putting on the crown. So you're looking at about a year to replace an upper second molar. And if you've also got bone width issues, well, it gets even more complicated. For lower second molars, we see a different problem. That opposing tooth, meaning the upper second molar, often starts dropping down into the empty space. Makes it really hard to fit a crown later. We might try placing the implant deeper, but there's a big nerve that runs underneath your lower teeth, so we can only go so far. Plus, those back teeth take a beating when you chew, which makes second molars tough to restore. Bottom line, not replacing a second molar is often your best bet. You avoid multiple surgeries, long healing times, and all the risks that come with implants in the tricky area. For most patients, the hassle, cost, and complexity just aren't worth it. So you might ask, what about first molars? Should those be replaced if lost? That's a different story. I'll cover that in an upcoming video. Now you might be wondering, what about that opposing tooth dropping down or other teeth are shifting? Fair question. To prevent that, we usually recommend a night guard. It covers your whole bite and keeps those opposing teeth from moving around. Clear retainers can help too. And hey, you can throw some whitening gel in there as a bonus. But for protecting your bite, a night guard is usually going to be more effective. So if your second molar is deemed unrestorable, here's what I want you to know. You'll probably be perfectly fine without replacing it. Replacement is possible, but it's a long road with plenty of bumps.